So I wanted to kind of take a few minutes to talk about kind of my background and my company, MobiCare. And when I was doing this before, I was trying to just get on and tell you all about it, and it was really boring. So I asked some of my patients and friends to kind of come up with questions that I could answer. So we're going to kind of do like a 20 questions with Katie thing. So this is a question that I get all the time. What is a nurse practitioner? So a nurse practitioner is a registered nurse with advanced training and education in the specialty of her choice. So for me, I'm a family practice nurse practitioner or a family nurse practitioner. I have a doctorate in nursing practice. All of my graduate education beyond my registered nurse training is family practice specific. So everything I learned in graduate school and all of my clinical training in graduate school was all family practice focused. So after receiving that advanced education and training, we are certified nationally, meaning we have to take a national certification exam in order to receive that certification that allows us to practice. So nurse practitioners are a little bit unique in our emphasis on health promotion and disease prevention. So we're going to be providing a lot of health education. We're going to be providing a lot of support as far as making healthy decisions and healthy choices and behavior changes. We sort of place a big emphasis on health promotion and disease prevention. Also, a very good question with kind of a big answer that I'll try to keep short and simple. Simply put, I don't like insurance companies. Really, primary care, in my opinion, has become so insurance company ran. And I think anyone who's in primary care would tell you that. It's pretty much the insurance company running the show. So it, as a provider in primary care, there are so many things that we have to do just for the insurance company that take a lot of time, which takes a lot of time away from actual patient care, and B, sometimes aren't really necessary. And I think this is sort of my trying to get away from that. And I love everything about being a nurse practitioner. I love patient care. I love taking care of patients. I love building relationships with patients and spending time with patients and talking about health promotion and disease prevention and how I can help support you in living your best life. And insurance companies kind of they make it difficult to do that because there's not a lot of time. So this is sort of my way of getting away from insurance company stuff and getting back to patient-centered care. One of the things that I don't like about insurance companies is the fact that we all pay these giant premiums every month to the insurance company, and we also have these giant deductibles. Most people go to their primary care provider 2 or 3 times a year. They never meet their deductible. So they're paying all this money for health insurance and they're never using it. The other thing on top of that, when you go to a primary care provider's office, a typical office visit is over $100. MobiCare visits, if you are a member, all visits are free. They're included in the membership price. And if you're not a member, a visit will run you anywhere from $35 to $99. $35 for a telehealth visit and $99 for a house call. So we don't have the overhead of a primary care provider's office, so we're able to provide services at a reduced cost. The other thing that I think is important to mention are lab tests. We are able to draw lab tests at cost for our patient. When you get your labs drawn at a primary care office, You're being charged for the lab test itself. You're also being charged a fee for drawing the blood in the provider's office. You're being charged a fee by the hospital that owns the provider's office. So there's all these hidden fees where and all of a sudden a $12 lab test is costing you over $100. At MobiCare, we're able to draw those tests without any hidden fees. So we're just charging you what the lab charges us. That's it. So that's another way that we can save you money. On top of saving you money, we can talk about convenience. There are a lot of things that we can diagnose and treat using telehealth. Telehealth is kind of new, and it really means using technology to provide healthcare services. So we use video chat, we use texting, we use email, phone calls. A lot of things, a lot of common illnesses can be diagnosed and treated that way. And if they can't, we provide house calls. Obviously, not having to leave your house is a good thing. I think for me, I've definitely been there. I've been that mom that has sick kids who the last thing you want to do is put them in the car and drive them to the primary care office. I've been the sick person who doesn't want to get up and go to the primary care office. So I think there's a better way to receive healthcare services. So I hope I answered some of your questions about MobiCare, about me, about Nurse Practitioner. I'm super excited about this whole company. I'm excited about the getting back to providing patient-centered care. I'm excited about doing the job that I've always wanted to do, and the way that I want to do it. It's going to benefit me as a nurse practitioner. I'm going to be able to provide that care that I want to provide, and it's going to benefit you as a patient. You're going to get so much more one-on-one attention. You're going to get that high-quality, affordable health care, and really that's the bottom line. That's what we're trying to do. So let me know if you have more questions.